Good afternoon, everyone. It's 12:01, so it is officially afternoon, and I know that lunch is coming up. So my name is Chad Blevins. I work at the Geo Center at USAID, based in Washington, D.C. I must say that the HOT Summit is my most favorite conference of the year. It's a chance where I get to meet all of the people that I've been virtually working with, over the last year or over several years. So it's a great opportunity for me to meet everyone face to face, and something that doesn't happen as often as we'd like working in a virtual world. So I'm going to talk about a recent project that I was working on with the Peace Corps. It's a collaborative approach to data-driven malaria prevention. But just as a little bit background on the Geo Center at USAID. So the Geo Center is a team of geographers and data analysts that support the entire agency of USAID. We conduct analysis, create maps, work with the different operating units and offices within USAID to provide them maps and information that they need to make decisions. We help build capacity within the agency, so we hold trainings and workshops. Every year we bring all the GIS specialists from around the world together. There's about 25 different countries that have GIS specialists, so we bring them to DC, or as many that can make it. And we have like a week-long training where we just talk about different ideas and projects and services and things that we can do to make their jobs better. And we also provide access. Part of that community building is providing them access to data, whether it be remote sensing satellite imagery or straight up data creation through our Mapping for Resilience program. So the Mapping for Resilience program is something that I run at USAID, and the director, Carrie, who I don't think is here yet, but she will be, created this line of, it's creating a new generation of maps for USAID as well as a new generation of mappers for the world. So through this program, we work with the different operating units within USAID and look for ways that geographic information can support their work, and then we set out to create that data in OpenStreetMap. In some cases, when we find projects that are creating data to support their project, we encourage those partners to do that in OpenStreetMap. And in certain instances, we'll actually support the creation of that data through our Youth Mappers program, which is run by Patricia Soleil, sitting there in the back. This was launched just under a year ago. There'll be a whole talk on this later this afternoon. But it was this idea of bringing university students together across the world and get them virtually working on projects together. There we go. So we also regularly, in addition to the Youth Mappers Network, we also regularly work with all of our friends within the OpenStreetMap community, including those with the Missing Maps Project and Mapbox and MapGive and Peace Corps, and there's Carrie now. So this project was really the first project that we worked on with the Youth Mappers. Supported the President's Malaria Initiative project, and so some background on that. The President's Malaria Initiative, or PMI, was launched in 2005. It's a U.S. government initiative to help reduce malaria-related mortality by 50% in 15 countries in sub-Saharan Africa. There's a range of malaria prevention techniques, from distributing mosquito. I know, I feel like we're in Mozambique right now with the blackouts. The power keeps going on and off. But so there's a range of techniques from, distributing mosquito nets, medication, and then also indoor residual spraying, or IRS. Indoor residual spraying is a technique where people, such as you see in this picture, go door to door and they'll spray the inside of a building with an insecticide that kills malaria-carrying mosquitoes. It's a very intensive, labor-intensive process. I've been told that at best it takes one person 10 days. One person can spray 10 homes in one day, right? So that's 10 people can spray 1,000 homes in 10 days straight. It's pretty labor intensive, and then you have to think there's a lot involved with that as far as getting the supplies, getting people trained, handling the logistics of actually driving around to every single house in these rural parts of the country. So because of that, maps can definitely play an important role in helping plan these activities. So how many people have actually mapped to support a malaria prevention program in this room? Okay, maybe about half, a little less. There's a lot of them on the tasking manager if you look. It actually kind of astounds me. So in the case of Mozambique, there's a lot of work going on with malaria prevention. A good friend of mine, Courtney Clark from the Office of Innovation, who has contact with Peace Corps volunteers in the field. She said, Chad, there's some mapping going on by Peace Corps volunteers already. There's a lot of volunteers in Mozambique specifically that have a health focus and have taken on malaria as the one project that they want to help work on and promote within their communities. A lot of those volunteers had taken a training in the Stomping Out Malaria Boot Camp, which is a Peace Corps training that they offer 3 times a year. So they've gotten some background on how to use OpenStreetMap. So we kind of started brainstorming ideas. We met with the Global Health Bureau at USAID. We met with some of the implementing partners who carry out those activities and started the conversation of how can maps help you with your work? What type of information do you need to know to help improve the effectiveness of your programs? And they said, well, we're starting to implement an IRS program in the Zambezia province for the first time this year, and we have absolutely no information on how many structures need to be sprayed, how many people live there. The last census is over 10 years old, and it wasn't very accurate at the time, so it's even less accurate now. And when they're going into an area for the first time, it's really tricky because there's, as I said, absolutely no information. So they really don't have a good idea of what to expect. If they've gone, there a year before, then they can kind of take notes and cross-reference from last year's data. There is a critical point. They need to hit 8 out of 10 homes in a given area where they're spraying in order for the program to be effective. And in some of these cases, in parts of Mozambique last year, they started spraying in areas and came short on their resources. They ran low on insecticide, reaching about 6 out of 10 homes, and it wasn't as effective as they had hoped. So this is, Kilimane. I thought this was a cool picture. It says Kilimane is on top of the world. Being from the northern hemisphere, I always appreciate when the world gets flipped upside down. So, as I mentioned, this was our first project working with the newly launched Youth Mappers program. And we created a mapping task for Malanje, Mokuba, Kilimane, and Dare. These are districts within the Zambezia province. The tasks were promoted amongst the Youth Mappers Network, and then Courtney and I held a slew of mapathons in DC and promoted the task locally, also with the hot volunteers. OSM Geo Week, we did some mapping there. We even had a mapathon at the White House, of all places, to support this work. And so bringing this this open mapping to the highest possible place you can, working in DC. So the mapping in the Zambezia province, it's in northern Mozambique. It's fairly rural, aside from the district capitals, which have populations of less than 200,000 people. It's very rural. They're big areas. We ran into a lot of the normal challenges that you do when you're doing remote mapping, such as the persistent cloud cover that's always right over that little town or village that you want to map. So we were using custom imagery services, but then you run into the problems of things being offset from one another. I know we've all experienced some of this. So working around those. So there was a need to, once the remote mapping was complete, there was a need to not only know how many structures were in a given area, but how many of those structures were sprayable. So malaria-carrying mosquitoes come out at night, so only structures where people sleep or reside in the evenings need to be sprayed. So that's when the Peace Corps volunteers came into play. Courtney and I traveled to Kilimane and coordinated 6 volunteers to meet us there in the district or in the provincial capital. We had 2 local Peace Corps staff and a few people from the APT Associates, who's the implementing partner that actually carries out the spraying in Mozambique and other countries. So we trained them on how to use OpenStreetMap and how to conduct, field surveys using Maps.me and field papers and identifying eligible structures to be sprayed. So that would be one where someone would sleep. So we trained the Peace Corps volunteers, and our plan was to, there it is. These are the enumeration areas in red. So we had this data from the local government. And so we were taking this data, exporting the OpenStreetMap buildings, and then getting a raw number count for how many buildings were in each one of these enumeration areas. So that way you can pretty accurately plan a campaign based on that 1 person per 10 structures. But some of these areas, actually I wish I would stop doing that, are more in the urban city. Some of these are more like in the urban area of the city, and some are more in the neighborhood. So obviously in urban areas, or the more central city locations, not as many people stay there. There's more, consist of government buildings and schools and those types of things. So we trained the Peace Corps volunteers to go through and identify the structures, and then they went out to the field. And as I mentioned, this is a very rural part of the country. Getting around is not very easy. So these are some pictures they sent to us, showing us the challenges when we said, hey, we want to have this area surveyed. They're like, oh, we can't get there. And look, this is the bridge that we had to cross to get to this last place that you sent us to. And can we find somewhere closer? And obviously, it's impossible to have volunteers survey every single house that's mapped remotely. So we worked with the PMI staff, and we identified areas, like every time I point, we identified areas, specific neighborhood areas that they wanted surveyed, and then we could say, all right, out of this little sub-block, this enumeration area, we found that 95% of the houses were actually sprayable, so then we could interpolate that result out to, for all urban areas, and then we did the same for rural areas. So this map here shows the points that the Peace Corps volunteers collected for sprayable homes. We didn't add that data into OpenStreetMap. We just kept the buildings as they were, but we ran the analysis using GIS software, just overlaying those points with the building polygons, and then got our figures that way. We're running short on time here. So some of the lessons learned from this project that we're doing another one now in Kenya, and we're definitely using all of the information that we learned from this first pass. But getting the authoritative data is very important as far as those enumeration areas or the boundaries are concerned. Being able to cross-reference that, because there were a variety of sources that came into us, and we had to figure out which one was the best to run the analysis on. So that was very tricky at times. Working with the local communities, so obviously the Peace Corps live in these villages. They know everyone there. They were working with community health workers. They were talking to the village chiefs. They were getting support to do this work, so everyone knew when they were going around with the GPS what they were doing, and they even got some help from local people to do the surveys. They were really interested in the work, and they would just follow them around and help explain what they were doing to other people in the community, so that was really helpful. And also the acknowledgement of mappers, and this is something, working in a virtual environment that it's not as easy to do as you'd hope or as you would want, but when you're working with a team or someone in real life, you can, go over, just give someone a high five and say, hey, great work. Smile, you can see people smile. That's something you can't do virtually. So trying to reach out to the people that were helping doing like significant parts of the validation and remote mapping, sending them a nice note or something, I think is goes a long way. So thank you to all the volunteers who helped with this project. And another line I'll steal from Carrie since she's here is, you're helping map places of the world that you'll probably never go, that's benefiting the lives of people that you'll probably never meet. So thank you very much.